The combined residency in internal medicine and psychiatry at Tulane is a 5-year program. You'll spend 2.5 years respectively between internal medicine and psychiatry. One of the unique things among med psych residencies, I think, about our program is that we front load a lot of our medicine time. So your intern year, you'll be spending 8 months on medicine and 4 months on psychiatry. And that's nice, I think, because you get a really solid foundation of medicine before progressing into your upper level resident roles.
The transition back and forth between medicine and psychiatry, the further along in training you are, gets less and less jarring.
The week's going to vary a lot depending on what rotation our residents are on. Of course, our residents rotate through the ICU, the medical surgical wards on medicine. They also do inpatient and outpatient psychiatric rotations, addiction medicine, geriatric medicine, and a variety of other places. So training in med psych, it goes fast because there's a varied amount of experiences that you get with this unique type of training.
We have this med psych unit where you get to be trained really much in like that combined sense of the program. So you get to practice your medicine and psychiatric skills at the same time. To parallel that, we have our med psych clinics as well. So from the very beginning of your training, you're already getting that dual training in how to be a practicing combined physician. So that by the time that you are entering into your more specific medicine or psychiatry realms of practice, you feel very comfortable navigating in between those two fields.
So at the end of a combined residency in internal medicine and psychiatry, you're both a board certified psychiatrist and internist. So theoretically, you can do anything that a psychiatrist and anything that an internist can do.
One of the great things about Tulane is that I've always felt really supported between this balance of like autonomy and coming up with my own ideas and management strategies, but running that by my supervisors and attendings and getting feedback from them on like what they think of that plan. So I always feel like I get a chance to kind of take a shot at creating and developing my own treatment plan. But if I'm ever lost or need additional guidance, we always have support and people around to help us through that.
Being in the med psych program, you get to dip your toe in a couple different pools. So we get to put our toe in the medicine pool and our toe in the psych pool. And then we also have our I guess I'm just gonna call it the med psych hot tub, because that's really where the party is. Our med psych program itself, I would say, is like very cohesive. Like everybody in the program is like a friend with each other. We hang out with each other. We look forward to seeing each other. We do our own retreats separate from the medicine and the psychiatric programs. So I feel like within our own program, there's a very strong sense of cohesion and we all look out for each other.
Your attendings and your program directors are phenomenal, and anything that you need, you can reach out. Same thing with, we try to do holiday events and even a resident retreat at the beginning of the year, and then Dr. McConville usually tries to host a beginning of the year kind of event just for us to get to know each other a lot better.
I think the culture at Tulane is not only, really opening and welcoming, but also like really celebratory. I feel like this program and the city finds reasons to celebrate really anything. We celebrate our individual accomplishments, our accomplishments as a program as a whole. We find a lot of opportunities to get together as colleagues and friends and as a team, and really not only, work together, but enjoy each other's company.
It's a place where you feel like you're supported by your people, you're carried by your people, everyone cares about you.
Tulane has done a great job of taking resident feedback. Attendings are always kind of making sure that you're doing well. There was one attending that specifically asked us on our first day of rotations, what is it that we can do for wellness for you? For me, it was, I need to eat. So he made sure that every time by noon we would have a lunch break and then come back if we needed to come back.
It's a super friendly atmosphere and environment. I think pretty much everybody at Tulane kind of has the mindset of like work hard, play hard. So when we're at work and we're seeing patients, we're giving it our all and we're putting our best foot forward. But the same thing goes for getting together outside of work and spending time with each other outside of work.
We don't need much excuse, I think, to want to come and spend time together. That's something that I've loved since starting in this program. My intern year was, wow, This is a group of people that work together and who also like to Mardi Gras and parade together and costume together and eat together and cook together.
New Orleans is an awesome city. I mean, it is my favorite city that I've ever lived in. Great music, great culture. We have such a unique population here. We're a great convention city, so you're going to have an opportunity to go to lots of great medical conventions every year without even leaving your own home.
The culture of New Orleans, I would be remiss if I did not say that is why I am here. It's why I returned.
It's just a city that's so full of life and culture and resilience, and you hear about it, but you don't really get the true sense of that until you're here and you're actually interacting with these people and like seeing how true that is.
It's a colorful city. It's a colorful city. It's a magical city. It's so many textures, the food, the cultures, the personalities. I feel like I'm a very quirky person and I feel like New Orleans like embraces who I am. So that's what I would say I love most. Like everyone is different. And I think that everyone is different in our med psych program as well. And it's like a nice reflection of New Orleans in a small little program.
Med psych doctors are people who tend to be on the creative side. We are the polymaths. We are people who maybe had multiple majors because we couldn't make up our minds about what was most interesting in college. We were the people who thought it made all sense in the world to be in a theater troupe, like while you were in medical school. I think it's special that at present, our program, our med psych program, has a host of faculty who have all graduated from the Tulane Med Psych Residency program. There's like layers of history and even just the changes that have taken place over the last decade. That knowledge and is retained. And there's also sort of, I think, an anchor and a sense of stability about who we are and what we offer and where we're going.